Wednesday, and that means it's time for us to delve into medical matters. Our resident GP is Dr. Vicki Skitter.
Hello again, I'm Dr. Vicki Skitter, and I'm going to talk about something that's maybe a bit personal to some people. So it's called ED, or erectile dysfunction. It's something that we really should discuss often, and we don't because people are a bit embarrassed. The definition of erectile dysfunction should be if it's difficulty maintaining your erection that lasts longer than 6 months and it causes emotional distress. So emotional distress, like, the man feels embarrassed, feels like he's letting his partner down. Sometimes they avoid physical contact in case the partner wants more. They feel less of a man, maybe not as masculine, and I think about it all the time. So it's a real problem. If you look at the stats, 52% of men between the age of 40 and 70 has some degree of erectile dysfunction. Almost 40% of those are found to have cardiovascular disease, okay? And more 50% of those has diabetes. So that's quite significant. Most people don't discuss it, as I said, due to embarrassment. Therefore, 75% never seek help. That's hectic, 75%. Why is it so important to discuss with your doctor or your partner? I think erectile dysfunction can cause reduced quality of life, obviously. It reduces your self-esteem. It can even cause anxiety, depression. It has a significant impact on your partner or on a relationship. And it can actually be a good predictor of cardiovascular events and possibly also diabetes. So we don't think about that. So if you look at the diabetes, 91% of patients with erectile dysfunction has some metabolic syndrome or insulin resistance, the precursor to diabetes. So metabolic syndrome would be a combination of being overweight, hypertensive, high cholesterol. That's, that kind of look. Also cardiovascular events. That's interesting. After the initial report of erectile dysfunction, 11% of those men reported a cardiovascular event 5 years after. So that is definitely significant. And it is even a stronger predictive effect in younger patients with erectile dysfunction. So it is important to, when you've got that, you go to your doctor. It's obviously important to discuss, but then also you need to do fasting bloods. You need to check your insulin, your sugar, your PSA, which is the prostate marker, the cholesterol, obviously check the blood pressure, and your testosterone levels. And these things we can treat. That's important to know. Remember, when you have your testosterone levels done, blood test, it needs to be in a fasting tummy or fasting state. And it needs to be done between 7 and 11 o'clock in the morning. So remember that. That's why it's so important to discuss your sexual health history as well as other stuff when you have your general check with your doctor. So let's try and do that. Who is at risk for erectile dysfunction, you might wonder? Men between ages between 40 and 50, men have a 50% increased risk for erectile dysfunction. So obviously you look at the age, that's a risk factor over 40. You look at the lifestyle, maybe they're overweight, maybe they've got a low physical activity, not eating properly, smoking, that can cause problems. Medical conditions, obviously, like diabetes, hypertension, heart disease, high cholesterol can cause it. With these illnesses, often you get vascular damage, and that affects the blood flow. So that's why. Some medications can cause it, and psychological stress. That's an important one, including financial issues, and we all know about that. It can cause, that's very common. Relationship problems can also cause that, obviously. We think about the partner as well. Maybe they've got issues. So it helps to include them, your partner, in the diagnosis. It does help. So when it comes to treatment of erectile dysfunction, Usually, if the man is still able to have his early morning erection, I think they call it a morning glory. If they have that still, then there's still functionality. Then one can try those PDE5 inhibitors. Those are the drugs like Viagra, Cialis, Ciavor, Danafil, Levitra. I don't know, that might ring a bell with you guys. There's lots of other generics as well. Patients that might be non-responders, where that blue pillicky won't help, maybe when they've got comorbidity issues like low testosterone, diabetes, hypertension, after prostatectomy, also with enlarged prostate, that's why we check the PSA as well. And there, a urologist often needed, so we can bring those okies in. It's also important to change your lifestyle. So if you can change the smoking and the exercise and the diet, obviously all of this helps. It's also important to know that those tablets can cause side effects like headache, a blocked nose, lightheadedness. It can lower your blood pressure. So if those symptoms, if you get those and they're quite severe, it might be better for you to take the short-acting tablets, not the long-acting, so that you for 3 days you walk around daisy and with a headache. That's not going to work, okay? So those pills basically, they increase blood flow to certain areas, and it's interesting. So when you see your partner's ears are red, then you know it's ready to go. So other advice on patients, on treatment is, if you suffer from ischemic heart disease, that means angina, unstable or stable, or previous heart attack, and you use those nitrates that you spray under your tongue, or the tablet that you put under your tongue, please do not use these tablets. That's contraindicated. If you don't have contraindications, it's important to know you take those tablets, we're talking about the blue tablets, on an empty tummy. Okay. Manage your expectations. It's very important to realize that often the first dose might not do the trick. In fact, it often takes 4 to 8 tries to actually get to the, proper action, I would say. Involve your partner also in the treatment. Tell them what's happening, be on the same page. And remember, they can also might have issues. They might not have a libido, they might be menopausal, they might be stressed. So it's important to know where both of you are. And have your treatment reviewed. Don't give up after one failed dose. Please don't do that. The last message I would say is, erectile dysfunction is a couple's disease. So you need to talk about this to your partner. So be proactive. The sooner you start treating, the better the response. So good luck to all you men there. See you next week. Bye.